Today, let us welcome a very distinguished person from the field of dentistry, my good friend and colleague, Dr. Naveen. He's the head of the Department of Public Health and Dentistry at Rungta College in Chhattisgarh. He brings to us a rich experience of more than 20 years in the field, and he's been a wonderful teacher and a mentor to a lot of postgraduate and undergraduate students. So let us not waste any time. Dr. Naveen, are you ready?
Yes. Hi, Amol. Good morning. Nice
Very
to talk
good
to you.
morning, Naveen.
Yes.
Thank you
Let's
for
go.
taking time from your busy schedule. So we are dealing with a very basic topic in dentistry. Before we move to our question and answer session to more detailed topics, I have been facing from our patients regularly. What is the correct brushing technique? If you can give some insight on that.
Okay. Generally, what happens, there are a lot of misconceptions among people with how they are supposed to brush their teeth. For a very long time, habitually, people have this habit of brushing their teeth in the horizontal method. Then some of them do circular, some of them do a combination of circular, horizontal, even vertical. See, ideally, the most convenient and the one which is very effective also is the vertical method, wherein you brush the teeth up and down. Upper teeth needs to be brushed downwards, whereas the lower teeth needs to be brushed upwards. And those areas, the back, again, is the same process. Front, you can always go with a circular motion to start with if it is slightly difficult. Whereas all other areas, front and back will always help. So up and down is a wonderful method wherein you can have a good oral hygiene and helps in removing a lot of food debris and plaque in the most efficient way. And not getting into the technicalities of the different techniques that we have learned as an UG student, as a BAS technique and all those things. This is in general where it helps the common man when we talk about easiest ways to brush up and down. Simple.
Yes, we are looking at the lay person who can actually get something from this particular session of ours. So yes, that's exactly what you said. Second thing, which you might have seen, a lot of patients are slowly moving towards electric motorized toothbrushes. So what's your take on that front? Is it better to have an electric toothbrush, or you still stick to the age-old manual toothbrush technique?
See, electric toothbrush has been a wonderful invention wherein it helps in taking care of those areas which generally with our normal conventional method of brushing, manual brushing might not be able to reach because we are not good at doing that or reaching those areas. So this electric brush do cover those areas with their oscillations and vibratory motions that they bring in with the electric thing. The only question or the only query or the hiccup that I have with electric brushes, it needs a lot of time and dedication from an individual because they need to do it on individual teeth. Whereas when you took a manual toothbrush, it covers almost 2.5 to 3 teeth at a time when you're brushing up and down. Whereas with an electric brush, the head of the electric toothbrush are much more smaller than our regular manual toothbrush. So it takes little more longer time. Yes, effective, but somebody has to give a good enough number of time. The conventional method of 3 to 5 minutes will not work with electric because it takes little more longer time. So if somebody is able to dedicate that time, then it will be of great use.
Right. Also, there's a considerable cost difference, so that is another thing that a lot of people need to.
Yes. We are living in a stage in a country where everything comes down to that. When some people are very much concerned about how much does it cost. So when they hear about the cost and the longevity, yes, again, that's a wonderful point that you have pointed that the cost is an important factor here.
And the same thing I would say about the water flossers. Water flossers are a wonderful invention, again, especially for post-treatment maintenance of multiple implant treatments, full mouth rehabilitation with dental implants. Yes, it takes a little bit of a time to get used to how to use that particular device. But once you get the hang of it, if you have seen in the Western countries, people have that water flosser which is permanently installed in their bathrooms. And now you have the portable versions as well. Waterpick, which was the pioneer in this particular field. But yes, water flosser is something, again, which you would agree with me, I strongly recommend for...
Certainly.
Yes, go ahead.
It's a great invention. Water flossers are one of the best things that can happen. In the past, for us to maintain a good oral hygiene, because now people are becoming more and more conscious. They want to have a good oral health. They want to make sure that they maintain their teeth well for the longevity of the teeth and the gums, and water flosser certainly adds a lot of value to our daily maintenance of oral hygiene.
All right. Another common question we get to hear from patients is they ask if it is fine if they brush for more than twice in a day. Definitely, once in the morning after you get up and once in the night before you go to bed is mandatory. But is it fine if they brush somewhere after their lunch or somewhere in the middle of the day? What's your take on that?
There's nothing wrong in brushing, but it's just that they should have all the amenities to do that and also the time for that, because brushing post any meal is always a wonderful thing, because it automatically, the moment you brush, it reduces a lot of food debris and plaque accumulation immediately. Right. So you need not have to wait for another 8 to 10 hours, by which the microorganism activity would have started in the oral cavity, when the plaque formation would have started with some period of time. So brushing immediately after a meal is a great thing. If they certainly have time, we can always advise them, if they have the time and leisure to do it, then no issues with that. Right. But twice, as you said, is more than enough.
Yes, twice is mandatory, in fact. Yeah. Let's move on to the last question for the day. Brushing, we have spoken about. Let's talk about another important thing, how to clean your tongue. Can you give me your input on that?
See, most of the people generally tend to forget that tongue is also a part of their routine oral hygiene maintenance. A lot of them think that cleaning the teeth, Absolutely. Brushing their teeth and rinsing their mouth is what takes care of oral health. But again, tongue is an important aspect, because there are a lot of coating that happens when we eat or drink anything other than water, which leaves a coat onto the tongue. So cleaning of the tongue becomes very mandatory. So generally, initially, when we go back in history, people used to clean their tongue with their fingers. Then came the concept of toothbrush. Then now people are getting into the habit of using tongue cleaners. Yes, certainly. Toothbrush and tongue cleaners, both of them have great adjuvant that you can add to your oral hygiene. Use the bristles of your toothbrush to clean your tongue, as well as, or you can use your tongue cleaner. I would recommend a plastic one and not a steel one. Generally, steel one, what happens, it ends up leaving some kind of a tear on the tongue or all those things. So people find it slightly difficult. And also always get into the habit of brushing it in straight lines, so that when you draw straight lines on your tongue, most of the areas you're covering from one end to the other end, and check in the mirror if there are no white patches on the tongue, which cleaning. So yes, tongue cleaning is important for maintenance of oral hygiene.
All right. Thank you, Dr. Naveen. I think we have covered the most basic things that we encounter in our everyday practice. Thank you once again for your time. We shall meet again to answer a few other questions that we get to hear from our patients on some other topic. Let's plan for that very soon. Thank you once again.
Thank you, Amol. Thanks a lot. It's a great initiative that you have started to pitch in such small topics. Again, being more basic, but still important to the patients on a day-to-day basis. And kudos to you for all further ventures. Certainly we'll catch up again for further more topics.